Hello, welcome to the podcast, the National Institute for Health Research. I'm Tara Lamont. I'm a scientific advisor to the Health Services and Social Care Delivery Research Programme. And today I'm joined by Nick Watts. Dr. Nick Watts is the Chief Sustainability Officer of the NHS. He's a public health doctor leading the team responsible for greening the NHS. And Professor Mahmood, who's a consultant ENT surgeon at Brighton, who's led work locally and nationally on environmental and sustainable practices, including ethical supply chains. So we're going to have a conversation about what greening the NHS and social care means and what the research agenda might be. But I'm just going to start off. This podcast is aiming to stimulate interest among researchers for a call that's now open through the NIHR for new research on evaluating new ways of working across the NHS and social care to deliver carbon reductions. So I just wanted to spend a couple of minutes before we get into the meat of the conversation with Nick and Mahmood, just saying a little bit about the programme and what we want to fund. It's a great opportunity for researchers who want to strengthen the evidence based on what works for organisations in greening health and social care. The Health Services and Social Care Delivery Research Programme, bit of a mouthful, but the HSDR programme that I support, it has a budget of over £20 million a year, and we fund high quality research on the organisation and quality of services. And we've supported in the past ambitious studies on important issues like, do centralising stroke services save lives, or are hospice at home services cost effective? And this is a new call for us on sustainable healthcare. And together with other programs of the NIHR, we're really wanting to fund some high quality research which will make a difference. In the past, I guess we've funded some studies that might touch on this. So, for instance, in our program, we've funded an evaluation of new build hospitals, looking at various dimensions, infection control, as well as energy use, staff satisfaction, and so on. But there's a lot more that could be funded across different settings in health and social care, and looking not just at the new interventions for better ways of delivering healthcare, but also redesigning clinical and care pathways to be more efficient, from renal to cancer services, and how to stimulate organisational change. So with no further ado, I'd really like to hear more from Nick. And if I start with you, Nick, and from your overview position, what are the biggest challenges facing the NHS to reach carbon zero?
It's a good question. And listen, thank you so much for having me here, Tara. Thank you, NIHR. This is energizing. It's exciting to be here talking about the future of healthcare, right? Not something that is just tinkering around the edges, but how we are going to redesign and reimagine the NHS. Nothing gets me more excited than this. Let me start by not answering your question. Surprise, surprise. Let me tell you what is not a challenge. What is not a challenge is ambition. When you go out to all 1.4 million healthcare professionals across the NHS and you say, hey, what do you want to see more of? They shout back at you, I want to work for an organization. I want to drive change in an organization that lives up to my values. I want to tackle climate change. 9 out of 10 of them. The next thing that is not a challenge is that, believe it or not, flows the whole way through the NHS, from an individual doctor, nurse, pharmacist, patient, down at the coalface, the whole way through. Every single person, everywhere I go, people are passionate, pulling you into doors, saying, how can we go further? How can we go faster? The other thing that is not an issue, and this will surprise people, capital. Access to capital is not as much of a barrier as I think people think it is. Number one, you don't need quite that much to respond to most of what the NHS needs to do on climate change. Number two, God, it's efficient. It pays back in 3.5 years most of the capital investments we might want to put in place. To the extent that we've been doing this since 2008, this program already has paid for itself 4 times over. But maybe then to answer your question, what are the major challenges? Well, if ambition and capital and passion isn't a challenge, one of the things that we run into is pace. Say it again, say it as often as you can. The climate crisis is a health crisis. It's a health emergency. And so you have to move quickly. And you will almost never be moving quickly enough. The second you go, God, that sprint for the last year was really tough, and you look back and go, did I go fast enough? The answer is probably no, not quite. You could have gone a little faster. And that is a challenge that we have to come to grips with. It means that we have to change the way that we are running the interventions. We have to be more innovative. We have to be open to getting things a little bit wrong every now and then. We have to be trying lots of different things. I think the other challenge we face is the NHS is big. The same strength, 9 out of 10 of 1.4 million staff. That also means that there are 1.4 million staff there, and no one person anywhere in London, Skipton House, anywhere in the chief executive's office of a hospital can transform the National Health Service to a net zero healthcare system. It has to be done with 1.4 million low carbon healthcare decisions every single day of every single week, month, and year. And that is tough, right? The behavioral change aspects of that, mobilizing that kind of workforce, it's just a tough thing to do at pace. The final thing, if I can have one more second, and I'm looking at your face and you look like you're okay with me continuing to talk. The final thing that I think we struggle with, the final thing we need more of is good ideas, great ideas, things that we can try out. We have an excellent, I would say, we have a really good long-term ambition, the net zero ambitions for the NHS, world-beating, right? No other healthcare system trying to move quite as fast, quite as ambitiously as the NHS is. We also, I think, have done a pretty good job, if you look backwards, of reducing our emissions in year. We've done a good job of putting together intervention 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. The gap is going to come at some point where you just need some good new ideas. You need other things you can try. Once you've tackled your big low-hanging fruit buckets of interventions, you need people thinking about, A, what can I personally do tomorrow morning? And B, what are the things that I need to do today so that in 2025, I can tackle the next big challenge? And it's that last part, which is why the NIHR why this call is so exciting, so essential.
That's fantastic. And I mean, Mahmood, what's your perspective where you work in terms of the challenges and what the service is doing to meet those?
Well, so I work both at the medical school, Brighton and Sussex Medical School, doing academic work, looking at how we can make healthcare greener. And I also work for the hospital, University Hospital Sussex. So in terms of challenges and what we are doing to meet those challenges, I guess perhaps most important for me to speak about from the clinical interface, and to start by saying there is, of course, a lot of enthusiasm for this topic. So we know that a lot of people in the NHS really, really do want to take on the green agenda, but not only in their personal lives, but also at work. So that's a good starting point. So what are the barriers? I think some of the barriers, of course, are time. Clinical people are very, very busy. And we're facing a lot of pressures, obviously, all the time. So what we need really is to make some time for people to be able to work on these issues. And my trust, I'm glad to say there's been some clinical time funded for individuals to step aside and have protected time to think about these things and rework clinical pathways and clinical streams. And then the other thing, I suppose, is about enabling change. Although there's enthusiasm, people have to feel emboldened to make those changes, and that requires both top-down and bottom-up leadership. So top-down meaning that the senior board of an organisation must put their strength behind the idea of a green agenda for the organisation, and bottom-up leadership meaning that we need individuals at the coalface really to be making the changes that are really going to bring this agenda to the fore.
Thanks. It's really helpful. And I wondered, Nick, if you had any other thoughts on, well, a couple of things that Mahmood was saying. One about the kind of indirect influence on the kind of wider supply chain. And then I think what you were talking about, Mahmood, was almost that kind of lean healthcare, isn't it? Thinking about um, redesigning services to reduce the burden, which will probably also, be increasing the ease for patients in reducing the need, perhaps, for so many hospital outpatient visits or whatever it is. Nick, did you have any comments on that?
To take them in reverse, hey, yeah, low carbon medicine is pretty much most of the time just good common sense medicine, good common sense public health interventions, right? Which is why when we say things like it could pay for itself, it is good for public health. It's true, because when you go and look at all the things that the Greener NHS team, that healthcare professionals around the world are trying to do to decarbonize healthcare, most health professionals will go, oh, well, that's the kind of stuff that I want to do as well. That's aligned with what I learned in, Foundations of Clinical Practice 101 in medical school. That is just good common sense medicine. We need to remind ourselves of that as often as we can. Yes, there are always going to be some tweaks where you need to do something in a slightly lower carbon way. You can almost always find a way to do that in a way that improves access for patients, improves care. On the broader point, entirely right. It is not possible, right? And I'm not trying to hide anything here. I say this as often as I can. The NHS, we've made a net zero commitment for ourselves. We've also been clear that we can't do it alone. If the NHS is the only healthcare system in the world attempting to do this, it won't be possible. It is only possible if healthcare systems across the world are moving with us at the same pace. God, I hope faster. And it is only possible if our supply chain is doing that as well. Only possible, right? And so to that end, the question I think starts to become, well, okay, what can the NHS reasonably do to accelerate that, to ensure people are moving at a pace that's appropriate? Number one, set a target. Set a very, very clear target. Say it as often as you can. Say it as publicly as you can. Within the decade, the NHS will no longer purchase from anyone that does not meet or exceed our commitments on net zero. Number two, start to engage. Start to talk to suppliers. Understand what the challenges might be behind that target. There are genuine innovation challenges. It's genuinely difficult to maintain a cold chain in a low carbon way. Doesn't mean that Novo Nordisk isn't interested in doing that. They supply, I think, about 50% of the world's insulin. They're absolutely committed, but they need support, and we need to work together as we do some of that. Number three, make sure that you're transparent about this. Make sure that you are counting carbon in a way that is consistent. Make sure that you are holding people to account for the way that you are counting carbon, that you're doing it in an expansive way, taking account of their global supply chain. And then finally, have some steps, right? I said within the decade. Within the decade is a decade away. Easy to say. What is harder to say is in a month or two, the NHS will introduce a new 10% weighting for every single tender for net zero and social care, every single tender that ENI does. 18 months from now, unless you have a publicly board-approved net zero strategy, you won't be able to win a contract with the NHS over £5 million. 2027, and that's a little bit further away, but that's because this last target is really tough. Public, board-approved, tackling your global supply chain, scopes 1, 2, and 3, as a qualifying criteria for doing business with the NHS. You need to be aligned with the direction we're heading. I think those sorts of things are the kinds of things you could reasonably expect. There's always going to be more, but it is worth reiterating that the NHS can't get to net zero without everyone else around us.
That's really helpful, and just reinforcing too the leverage that the NHS has as the consumer and procurer of services and goods, and also as an employer.
Can I, Tara?
I wondered.
Sorry, just to rudely cut in. I'm so sorry. Yes, as a procurer. Yes, as an employer. My accent reveals I'm Australian. I can tell you that the Australian healthcare system looks to the NHS for questions about how a good healthcare system should run. it's not just about the dollars, it's not just about the pounds, and it's not just about our employment, our size. It is also that we are looked to the world over for an example of how to run a high quality healthcare system. And if we can start to say, listen, a high quality healthcare system is a low carbon healthcare system, everyone else is going to follow. Sorry.
No. It's great to hear that that ambition to be a well, and the reality of being a world leader in that sense. I wondered, Mahmood, because obviously we're thinking about the research that we want to fund. What are the kind of big areas of uncertainty? Where would you really like to see some good evidence that would help you in some of the decisions that you could make to green your service?
Well, in terms of big areas of uncertainty, well, I guess perhaps here I can put on my academic hat and start to think about some of the broader questions that I think remain unanswered. So, first of all, perhaps it's about things like how do we reimagine care? So things like remote consultation, digitization of health. We've seen all of these technologies coming through, and really they've got to be part of the future. I know that a lot of clinical staff, doctors are a bit tired of things like remote consultation, patients too. So rather than having a blanket no to this, of course, we need to understand where this is best utilized, what sort of conditions and what sort of scenarios. And more importantly, we don't need short-term outcomes. We need to understand what this means to the long-term care of the patient, both in terms of patient satisfaction, but in terms of their care pathway. We don't need patients circling back because they haven't received definitive care. But look, if we look at the wheel that we know the greener NHS has produced, looking at where carbon footprint is, there's other things. Of course, there's the huge amount of carbon that comes from our supplies, particularly things like pharmaceuticals. So we need to look at where we can deprescribe. What areas are there where we're overprescribing, or where there are alternatives to prescribing pharmaceuticals, not just inhalers, which have high carbon, but everything across the board. In terms of the equipment we use, where is it that we could reduce and reuse, and what are the drivers and barriers to that? To change, such as economic barriers or concerns about patient safety or infection control that we can try to break down. But on top of all of this, I think another important aspect is behaviour change. So there can be barriers to behaviour change, both from staff and from patients, for example, on the public health agenda to make their own health better. And that is because of entrenched behaviours and cultures. And what are the drivers of the behaviours and cultures, and how do we create a new mindset for the future?
Nick, were there any other thoughts you had about big gaps in knowledge?
Should never admit this, right? But the gaps are everywhere, Tara. I said at the very, very start, we're not talking about tinkering around the edges of what a healthcare system is. We're talking about transforming it, redesigning it, doing it in a way that is better for health of our patients, tackles directly health inequalities, improves environmental health, air pollution. So it is probably to be expected that we have a heck of a lot of questions because we're looking 10, 20 years forward. So I see problems everywhere, or questions everywhere. Every single individual in the healthcare system, every single person has one bucket of carbon, handful of carbon that they personally are responsible for. They personally control in a way that no one else can really quite get to. And we have seen our best examples of transformational change come from when a nurse or a pharmacist or a GP figured out that they had that bucket of carbon, figured out what they could do about it, and then ran at it, really took it on. And in fact, most of the time, they blow the targets we set out of the water because they have such passion, when you empower someone. Again, 9 out of 10 of our 1.4 million staff. And so I'd love to see more of that. We know a lot about what we might want to see for inhalers, for some of those volatile gases, for anesthetics. We know a bit about nephrology, a little bit about mental health. But the world of medicine, the world of healthcare is broad. And I would love to see everyone, professions, different tribes of healthcare professionals, taking a look at the macro net zero strategy and thinking to themselves, what does this actually mean for me tomorrow morning when I show up at work? What could I actually do tomorrow? What could I do next week? What could my ward do? What could my department do? What could my hospital do? The more of that we have, I think the closer we get to hitting net zero. I'm less worried about the big mega infrastructure changes, right? The big capital expenditure changes. The NHS last year alone invested £360 million into healthcare decarbonisation, into making our estate more efficient in a way that was lower carbon. We can cover that stuff. It's the stuff that hits the interface of that clinical patients that interaction where I think we need the most support.
And I think for the program, the issue is marrying those 100 great ideas on the ground for reducing carbon with some high quality science, which ensures that there's some transferability, and it's not just a kind of bunch of pre-post tests which might not be generalizable to other contexts in the same way. So I think we're looking for some really exciting teams that can combine real knowledge of services and clinical areas and service user needs with some really high quality mixed methods evaluations. I don't know, we're almost out of time, but I don't know, Nick and Mahmood, if you have other thoughts just about any other sectors or examples from other countries that have inspired you that might be good places to look for new research ideas or to transfer from one setting to another. Is there anything that springs to mind?
Mahmood, why don't you go first, Matt?
So in terms of what we can learn from other areas, of course, there are other industries working in sustainability, and we should look to those to understand how they build things like circular economies, how they create behaviour change within organisations. But I think within healthcare, we can also look elsewhere. I mean, a particular example that comes to mind is some ophthalmologists that I've been speaking to in India, working at the Aravind Eye Centre, and there they have a highly efficient system for delivering cataract surgery where patients are operated in an open theatre, almost like a factory line. Not that we want to dehumanize these patients, but it's about creating efficiencies, and all equipment is reused. And what they found is that their carbon footprint for a cataract operation is 1/30th of the same operation performed in the UK, without any evidence from auditing 2 million operations of any worse outcomes. In fact, their outcomes were better. So this is actually the better method of healthcare on all the metrics that we can think of. And so perhaps these are the models that we should be looking to in the UK as well.
Great. Those are great examples. Yes. We're almost out of time, but I mean, Nick, would you have any sort of closing thoughts for researchers who are thinking about whether or not to put in applications?
Oh, yeah, put an application in. This is the challenge of a century, challenge of a lifetime. We need all the help we can get. We have seen original research in health and climate change increase 11-fold from 2007 to 2020. Now, that's a huge relative number. It's big, because back in 2007, the absolute number was very, very small. There is a growing community of researchers, of health professionals starting to engage in this space. My reflections on that community are that we are strongest when we recognize that, hey, we've actually been a little bit slow to arrive at this discussion, arrive at this debate, arrive at this fight. Go speak to the architects, go speak to the engineers, go speak to the environmentalists who can tell you about how to design healthcare systems all the way across the world in ways that are energy efficient and better for patients. Go speak to people about ecosystem-based adaptation and how it can improve heat and flood defenses across the NHS. Go and speak to the Scandinavians about all of the impressive work they do with low carbon inhalers and low carbon volatile gases. Go and speak to the Germans about some really innovative battery technology they have, which we think is going to be incredibly powerful over here in the United Kingdom for our ambulances. Everywhere you look, I think you will find collaborators to engage in this space. There are industry sectors, countries out there who are so much further ahead that we can steal from and leapfrog with them. I'm really excited about this call, Tara. You can hear it, I hope, in my voice. I'm so energized by the promise of support, by the promise of the cavalry of the world's best healthcare professionals, best academics are about to come and help drive and deliver a net zero NHS.
That's fantastic. Thank you so much, Nick Watts, Mahmood, Bhutta. And we leave with, as you say, Nick, a real sense of excitement about the importance and urgency of this research. And the programme really wants to fund a lot of ambitious, high-quality studies. The call closes on the 24th of May. And do contact us if you have any queries about your applications on hsdr@nihr.ac.uk. And thank you for joining us today.
Thank you. Thanks for everything you're doing.